This is a 16-year-old girl with a scoliosis, which is a curvature of the spine. This is a problem that in the United States is sort of a quick fix. In some developing nations, they don't have the means by which to fix these problems, and it's really a shame. And once we heard that, this was going on, and we said, well, how can we help? I think we're going to be able to get you over here and do your surgery.
Thank you. I'm very pleased to hear that. I appreciate that great. This is the best news I've had all year, man. She's all smiles.
At first, I did not know I had scoliosis until it was one day until my mom looked at me and she goes, "You look twisted." It was there, but it wasn't noticeable. As I got older, it became more noticeable to my friends and to people who didn't even know me. I didn't feel comfortable going out in public, and as most people who know me, I always wore a jacket. Because if I took the jacket off, in my skirt, you could kind of see it. I looked lopsided, and I didn't feel comfortable. Once I was diagnosed with scoliosis, it was too late for me to be treated with the brace. I was so far gone, and they just knew that I had to get the surgery. Dinah has done so much for me. She knew about my case for a very long time, for about 2 or 3 years now. And when we first mentioned to her what was going on, she offered to help immediately. That's just the type of spirit she has.
Thursday morning, we know where we go.
My name's Dinah Caskey, and I'm a missionary in the Bahamas. My husband and I are involved with Bahama Mission, which we've been doing for 34 years. After I learned about Leandra's scoliosis when she was a freshman in high school, through the years, when I would ask different people to help and always got to know, I actually got almost embarrassed to see her because I never had any good news to give her. The Rolle family did some work too. I know that they went down to Miami and checked on getting help, and at the end of their search, they found it would be a minimum of $250,000. And that's just money Bahamians don't have. Leandra looked perfect, and in the Bahamas, many times people don't get insurance for the children. There were a handful of people through time that I called, and in the beginning got yeses, but towards the end got nos, and then eventually got through to the Florida spine specialist, talked to Dr. Hirschman,
Finally.
and he said yes.
So nice to finally meet you.
Nice to meet you. When we found out about the Florida spine specialist and they offered to help us, we were amazed, we were shocked, and we were so excited, and we just wanted to trust. We trusted God, and we went along with everything, and they helped us, and I'm just so excited. So they played a big help in helping me get the surgery.
I want you up, walking around the very first day after surgery. Okay. Scoliosis is actually a somewhat common condition. Scoliosis, by definition, is any curvature that's greater than 10 degrees. Most of the time is a non-operative condition. Patients will come to us with a 10-degree curve, a 15-degree curve, sometimes even a 20 or 25-degree curve, but none of those curvatures require any sort of surgical intervention. But when people come to us with a curvature like Leandra's, where it's 58, 60, 70 degrees, well, then we have to intervene. The type of scoliosis that Leandra has is what we call adolescent idiopathic scoliosis, and that's the most common type. There's a lot of psychosocial issues, especially in a young teenage female, where we know that there's a cosmetic concern as well. And of course, it's very fatiguing to be sort of shifted off to the side like Leandra is.
Self-image became a big thing for me. It can really affect you, and it makes you think, okay, what are people gonna say if you wear this? Is this too tight?
When I talked to her, I asked about her social life and learned that she stayed home. She was really focusing all her energy into her school. I felt bad about that. I learned from her that she could no longer do her basketball or volleyball or her sports. It was beginning to get too painful.
And when you're playing sports, if you don't feel comfortable doing it, it doesn't make any sense. And I just didn't feel comfortable playing that.
Now that we have this, I'm so happy about it.
First few days you're gonna hate me, okay? And it hurts, okay?
Yeah, I know.
And after about a week or so, you really kind of start to feel much better.
Okay.
And then after 2 weeks, you're feeling even better. But realistically, right, to really feel like, oh wow, I feel better, it takes like 6 to 8 weeks. We're not just operating on one bone. We're operating, in Leandra's case, on about 15 bones. And we have to tie these 15 bones together and really change their position and manipulate the spinal cord and manipulate several nerve roots. And the body doesn't like that. The nice part is that kids definitely heal faster than adults. So the fact that you are so young, so healthy, and so thin really bodes very well for you. And realistically, this is a life-changing surgery.
Yes.
It's a life-changing surgery. Once you heal up, you have absolutely no restrictions. You can go bungee jumping, skydiving for all I care.
Okay.
She's just a wonderful human being, and if anybody deserves to get this surgery, I really believe it's her. This surgery opens up her world.
Hey, stranger. Hi. Leandra had her surgery, and I think it went really, really well. You look good. The surgery itself was uneventful, which is exactly the way we like it, and we were able to get a very good correction on her, and I think she's going to be very, very happy in the end. Leandra's curve started just shy of 60 degrees, and we got her down to probably around 5 degrees or so, maybe a little bit less than that. It's only been 2 weeks since surgery, and her incision looks like it's already healed up completely, and she's moving around a little bit more freely. Obviously, she's going to have some good days and bad days, and she will certainly have muscle spasms, but I think overall, Leandra is certainly ahead of schedule. You have to give her body time to heal, and that's really going to take 6 months to a year.
You have grown 1 3/4 inches. You are actually now 5'7" 3/4.
Okay.
You are taller. Very nice.
What I will tell you is that over the next year, you will actually get even straighter. Wow. Okay? And this surgery, the way that the surgery works is we straighten you up and we hold you in place, but it's your body that actually does the final healing. I think every doctor goes into medicine with very altruistic intentions. Leandra is the exact person that you really want to root for in life. She is the nicest kid you could possibly ask for, so polite, so pleasant, so well-mannered, and so appreciative. And so, being able to perform a surgery, a life-changing surgery on a kid like that, it's everything that I went into medicine for. This is really a truly, truly rewarding experience.
He's making a big difference in my life, and anybody who is making a difference in anybody's life as big as mine, I mean, they deserve a thank you. I'm looking forward to the future and looking forward to a better me, and my spine being straight and going back to things that I want to do and that I love to do. Dr. Hirschman, since you helped me in getting my spine straight and putting all the pieces together for helping me to get this surgery, I have a challenge for you. I would like you to come to the Bahamas so we can play a game of my favorite sport, which is volleyball. And I'd like to see who's going to be the winner. But hey, I'll go easy on you, I promise. But I think it'll be fun, really fun. So come over, please. And I'd like to play volleyball with you.